clients or residents disclose information pertaining to their condition and at times including personal issues during person-to-person interactions. To whom can the nurse aide share the information regarding a client's progress? A. To other clients in the unit who show concern to this client. B. To the client's family and friends. C. To anyone who inquires about the client's condition. D. To the members of the healthcare team on the next shift. Answer: D. To the members of the healthcare team on the next shift. An 85-year-old client in a nursing home tells the nursing assistant, "Because the doctor was so insistent, I signed the papers for that research study. Also, I was afraid he would not continue taking care of me." Which client right is being violated? A. Right not to be harmed. B. Right to full disclosure. C. Right of self-determination. D. Right of privacy and confidentiality. Answer: C. Right of self-determination. Although the client refused the procedure, the nurse assistant insisted and inserted the urinary catheter. The administrator of the facility decides to settle the lawsuit because the nurse assistant is most likely to be found guilty of which of the following? A. Battery. B. Assault. C. Invasion of privacy. D. An unintentional tort. Answer: A. Battery. The primary care provider wrote a do not resuscitate (DNR) order. The nurse assistant recognizes that which of the following applies in the care of the client? A. The client may no longer make decisions regarding his or her own care. B. The team will continue to implement all care focused on comfort and symptom management. C. The client and the family know that the client will most likely die within the next 48 hours. D. A DNR order from a previous admission is valid for the current admission. Answer: B. The team will continue to implement all care focused on comfort and symptom management. The nurse assistant's spouse undergoes surgery at the hospital where the nurse assistant is employed. Which of the following practices is most appropriate? A. Because the nurse assistant is an employee, access to the chart is allowed. B. The relationship with the client provides the nurse assistant special access to the chart. C. Access to the chart requires a signed release form. D. The nurse assistant can ask the surgeon to discuss the outcome of the surgery. Answer: C. Access to the chart requires a signed release form. The nurse assistant notices that a colleague's behaviors have changed during the past month. All of the following behaviors could indicate signs of impairment except: A. Increased absences from the unit during the shift. B. Administering drugs ordered to clients beyond her scope of practice. C. Forgets to sign out for obtaining articles. D. Interacts well with others. Answer: D. Interacts well with others. When an ethical issue arises, one of the most important responsibilities in managing client care situations is which of the following? A. Be able to defend the morality of one's own actions. B. Remain neutral and detached when making ethical decisions. C. Ensure that the team is responsible for deciding ethical questions. D. Follow the client and family wishes exactly. Answer: A. Be able to defend the morality of one's own actions. CNAs are employed in different healthcare settings caring for clients with varied conditions. If a CNA is employed in a skilled nursing facility, he or she is serving in A. Hospital. B. Rehabilitation center. C. Hospice center. D. Nursing home. Answer: D. Nursing home. Mrs. X, a 76-year-old client, is recovering from stroke. After being discharged from the hospital, clients, particularly older people like her, will be referred to what kind of healthcare facility? A. Hospice facility. B. Subacute care center. C. Group or communal home. D. Respite facility. Answer B. Subacute care center. Assistive devices are necessary to help clients ambulate. When assisting a client in learning to use a walker, it is important to A. Put padding all the way around the top rim. B. Let him walk by himself so he gains independence. C. Stand behind him and use a transfer belt. D. Let him practice using the walker on the day he is discharged. Answer C. Stand behind him and use a transfer belt. The nurse aide is monitoring the urine of a resident with minimal output. He may be suffering from urinary retention. Urinary retention refers to A. A normal output of urine. B. Incontinence. C. A large output of urine. D. An inability to urinate. Answer D. An inability to urinate. In caring for elder clients, you need to be aware of normal age-related changes. Presbycusis is usually related to difficulty hearing. A. Loud sounds. B. All sounds. C. High-pitched sounds. D. Rapid speech. Answer C. High-pitched sounds. Before providing any care, you must assure the identity of your client. Which is the best way to safely identify your client? A. Checking the name tag. B. Asking him or her to state name. C. Calling his name and waiting for response. D. Checking the bed plate. Answer B. Asking him or her to state name. After optimal recovery from spinal injury, Mr. Jack is placed on a bowel and bladder training program. He has not had a bowel movement for more than 2 days. What should the nurse aide do? A. Give the patient an enema. B. Offer prune juice. C. Increase fluids. D. Report it to the nurse in charge. Answer D. Report it to the nurse in charge. Following a motor vehicle accident, the parents refused to permit withdrawal of life support from the child with no apparent brain function. Which moral principle supports the nurse assistant's action? A. Respect for autonomy. B. Non-maleficence. C. Beneficence. D. Justice. Answer A. Respect for autonomy. After recovering from hip replacement, an elderly client wants to go home but the family wants a nursing home placement. Acting as a client advocate, the nurse assistant would A. Inform the family that the client has the right to decide. B. Help the client and family communicate their views. C. Suggest hiring a lawyer. D. Ask the provider to discharge the client home. Answer B. Help the client and family communicate their views. Care in the home is an alternative to hospital placement. One major difference associated with in-home care is that it A. Does not focus on curative care. B. Is less able to manage complex symptoms. C. Facilitates extensive involvement of family. D. Allows pain medications not permitted in hospitals. Answer C. Facilitates extensive involvement of family. If a primary care provider prescribed the following, which can be delegated to a home nurse aide? A. Feeding and bathing the client. B. Teaching about medications. C. Assessing wound healing. D. Adjusting oxygen flow. Answer A. Feeding and bathing the client. A sign of caregiver role strain is A. Asking others for help. B. Weight loss and insomnia. C. Asking for ways to help the client. D. Appearing sad during prognosis discussion. Answer B. Weight loss and insomnia. The proper medical abbreviation for before meals is A. PC. B. Bid. C. OS. D. AC. Answer: D. AC. The medical term for high blood pressure is A. Hypertension. B. Tachycardia. C. Hypotension. D. Heart failure. Answer: A. Hypertension. A resident with dysphagia should be on which diet? A. NPO. B. Clear liquid diet. C. Full liquid diet. D. Mechanically soft diet. Answer: D. Mechanically soft diet. To promote independence for a resident with Alzheimer's who is wandering, the nurse assistant should A. Confront and insist she stay in her room. B. Ask a family member to watch her. C. Place a familiar object outside her room. D. Write the room number on paper. Answer: C. Place a familiar object outside her room. Intake and output records should be totaled. A. Every shift. B. Twice a day. C. Every 4 hours. D. Every 12 hours. Answer: A. Every shift. When admitting a client, the nurse aide should observe and record A. Stool color and urine amount. B. Bruises, marks, rashes, lesions, or broken skin. C. Food and fluid intake. D. Insurance information. Answer: B. Bruises, marks, rashes, lesions, or broken skin. The hierarchy of human needs was proposed by A. Jean Piaget. B. Sigmund Freud. C. Abraham Maslow. D. Halbert Dunn. Answer: C. Abraham Maslow. Maslow's hierarchy includes A. Nursing process steps. B. Physical, mental, social, spiritual. C. ABCs of care. D. Physiologic, safety, love, esteem, self-actualization. Answer: D. Physiologic, safety, love, esteem, self-actualization. The most professional intercom response is A. Kindly state your name. B. What do you want? C. This is, name, CNA, may I help you? D. Please wait for the nurse. Answer: C. This is, name, CNA, may I help you? To orient a newly admitted client, you should A. Restrict use of devices. B. Show how to use the call light. C. Ask visitors to leave. D. Raise side rails in bed. Answer: B. Show how to use the call light. When arranging a client's room, do all except A. Administer medications. B. Check signal cords. C. Adjust bed rests. D. Check lighting. Answer: A. Administer medications. Standard precautions should be practiced when A. Providing oral hygiene. B. Dressing a client. C. Feeding a client. D. Ambulating a client. Answer: A. Providing oral hygiene. The proper position for a cleansing enema is A. Semifowlers. B. Lithotomy. C. Left Sims. D. Prone. Answer: C. Left Sims. Rapid heart rate, rapid breathing, and dry mouth are signs of A. Emotional stress. B. Physical stress. C. Cognitive stress. D. Affective stress. Answer: B. Physical stress. Methods of disease treatment outside conventional practices are called A. Castigo de Dios, B. Yin and Yang, C. Shaman, D. Folk medicine. Answer: D. Folk medicine. Demonstrating pride in ethnicity includes A. All of the above, B. Giving ethnic names, C. Wearing special clothing, D. Valuing physical traits. Answer: A. All of the above. A desired outcome of a therapeutic relationship is A. Friendship, B. Restoring health, C. Comfort only, D. Self-awareness. Answer: B. Restoring health. An example of verbal communication is A. Moaning, B. Laughing, C. Writing, D. Crying. Answer: C. Writing. An example of nonverbal communication is A. Speaking, B. Moaning, C. Reading, D. Writing. Answer: B. Moaning. An obstacle to effective communication is A. Therapeutic touch, B. Active listening, C. Asking about feelings, D. Interrupting the client. Answer: D. Interrupting the client. The most appropriate response to a worried client is A. That's understandable. Would you like to talk about it? B. Don't worry. C. It's routine. D. Doctors do this daily. Answer: A. That's understandable. Would you like to talk about it? Sitting at eye level helps because it A. Shows full involvement, B. Prevents feeling rushed, C. Demonstrates active listening, D. Controls nonverbal cues. Answer: A. Shows full involvement. Visually impaired clients read best with A. Small black print, B. Large black print on white paper, C. Large blue print, D. Small blue print. Answer: B. Large black print on white paper. Communication with hearing-impaired clients is best facilitated by A. Avoiding certain letters, B. Standing by the bad ear, C. Lower voice pitch and speak clearly, D. Raising pitch and whispering. Answer: C. Lower voice pitch and speak clearly. Client records must be objective and accurate because they are A. Used by all staff, B. Property of the agency, C. Readable by the client, D. Legal documents. Answer: D. Legal documents. Who is most likely to have a higher than average temperature? A. Depressed person, B. Average day person, C. Anxious person, D. Night shift worker. Answer: C. Anxious person. Awareness of one's heartbeat is called A. Arrhythmia, B. Pulse rhythm, C. Dysrhythmia, D. Palpitation. Answer: D. Palpitation. Average daily water intake for adults is A. 1,200 to 1,500 milliliters, B. 1,500 to 2,500 milliliters, C. 1,000 to 2,000 milliliters, D. 2,000 to 3,000 milliliters. Answer: B. 1,500 to 2,500 milliliters. Best oral hygiene to remove bacteria between teeth is A. Dental floss, B. Jet spray, C. Mouthwash, D. Electric toothbrush. Answer A. Dental floss. A partial bath refers to A. Washing genitals only. B. Cleaning from clean to dirty areas. C. Washing areas prone to odor. D. Washing entire body at sink. Answer C. Washing areas prone to odor. The first action when a fire occurs is A. Notify the switchboard. B. Turn off oxygen. C. Use extinguisher. D. Evacuate people. Answer D. Evacuate people.